Right, this is a one-year follow-up in a patient with Hashimoto's thyroiditis. And to the left, we've got the picture before treatment. We see that the thyroid, the right lobe, is contracted, as if glued together from the inflammation. And we see that the sheath on the outside is somewhat blurred. It's very difficult to say where the thyroid ends here and where it starts. We see dark spots inside the thyroid, which are an indication of acute inflammation, and we've got whitish, opaque structures that are indicative of scar tissue. And when we take a look on the right-hand side, we've got the follow-up where we see a regular restored thyroid structure. It's kind of a four-edged organ, whereas here it looks contracted and kind of roundish. We see that it has regained its healthy structure. That's more or less what a thyroid looks like in the ultrasound, a healthy thyroid, whereas here we've got a completely changed picture where it doesn't even look like gland tissue anymore. Most of the dark areas here have disappeared. We've got tiny whitish structures that are indicative of a rest of scar tissue, and we've got very clear borders to the thyroid, which is always an indication that the inflammation is gone. But what I consider most important and most interesting is when you look on the left-hand side, if you make an ultrasound of the thyroid, you look basically from upwards down to below. That's from the outside to the inside. So we've got skin here, we've got tissue underneath the skin, and then you've got muscles. And look at the structure of this muscle. It's kind of whitish, it's more light, which is a typical change that you see when you have an inflammation of the thyroid, which moves across the borders of the organ and affects the surrounding tissues, and that is kind of an inflammation of the muscles and an inflammation of connective tissue. When you look at the muscles here, they have regained a normal structure also. They are much darker, as muscles should be. When you, in the ultrasound image, you even have those fiber structures that are normal to muscles, whereas here you wouldn't even be able to say if this is a muscle tissue or something else. So you can tell that an acute inflammation of the thyroid affects the surrounding tissues and changes them and contracts them, and you have a lot of scarring, which is actually visible when you look at the patient from the outside. If you look at their neck, you can most of the time tell whether they have an inflammation of the thyroid or not. And here all this is restored. So it's a very interesting change. I think it shows that a holistic approach to healing the thyroid is actually working. And in the beginning, before treatment, the patient took 100 micrograms of L-thyroxine as a hormonal supplement therapy and was switched over to natural desiccated thyroid, which by this time has already a much reduced dosage. So you can also see that the function of the thyroid is improving, not only the anatomical structures. But what is most interesting about these pictures is that with the ultrasound, you have a way to see what you're doing when you are trying to treat the thyroid. You are no longer staring at lab results, or you're no longer supposing what is happening in the thyroid. You can actually see what is happening, and so I think there can be no doubt that from the status on the left-hand side to the status on the right-hand side, there has been a tremendous change, and the thyroid is actually almost cured.